Hey, stop. I know you don't have time and got millions things to do, I get it. But you do have a responsibility to the children you will one day bring into this world. What I'm about to say could protect you and your family from a lifetime of preventable tragedy. If you, your siblings, or your children ever plan on getting married, or even if you are already married, you cannot afford to skip this video. I am Dr. Ammon, Assistant Professor and PhD in Genetic Diseases. Essentially, I help you understand, protect, and fix the genetic blueprint of your children on this channel. Genetic diseases have affected humanity throughout history, yet they remain surrounded by myths, misunderstandings, and unnecessary fear. These misconceptions not only spread misinformation but can also cause emotional suffering, social stigma, delayed diagnosis, and poor medical decisions. Understanding the truth about genetic diseases is essential for building healthier families and more compassionate communities. One of the most common myths is that all genetic diseases are inherited directly from parents. While many genetic conditions are passed down through families, not every genetic disease is inherited. Some result from new genetic changes, known as spontaneous or de novo mutations, that occur for the first time in an individual without being present in either parent. Another widespread misconception is that genetic diseases always appear at birth. In reality, many inherited conditions do not become noticeable until childhood, adulthood, or even old age. Some disorders remain silent for decades before symptoms develop. Many people also believe that genetic diseases are always rare. Although individual disorders may be uncommon, genetic diseases as a whole affect millions of people worldwide. Thousands of different inherited conditions have been identified, making genetic disorders collectively a significant global health concern. A common social myth is that genetic diseases are the result of sins, curses, bad luck, or supernatural forces. Modern medical science has shown that genetic diseases arise from changes in DNA and chromosomes. They are biological conditions, not punishments or signs of moral failure. Another misunderstanding is that if no one in a family has a genetic disease, future children cannot inherit one. However, healthy parents may unknowingly carry recessive genetic variants without showing any symptoms. When both parents carry the same altered gene, they may have an affected child despite no previous family history. Some people believe that having one child with a genetic disease means every future child will have the same condition. In reality, the risk depends on the specific disorder and its pattern of inheritance. Each pregnancy usually represents an independent probability rather than a guaranteed outcome. There is also a misconception that genetic diseases cannot be diagnosed until symptoms appear. Today, advances in genetic testing allow many inherited conditions to be detected before symptoms develop, during pregnancy, or even before conception through carrier screening and reproductive planning. Many assume that nothing can be done once a genetic disease is diagnosed. While not every genetic condition can currently be cured, many can be managed successfully with medications, physical therapy, specialized diets, surgery, rehabilitation, and regular medical care. Early diagnosis often leads to better outcomes and improved quality of life. Another myth is that people with genetic diseases cannot live productive or fulfilling lives. In reality, many individuals with inherited conditions pursue education, careers, marriage, parenthood, sports, and artistic achievements. With appropriate healthcare and social support, they contribute greatly to their communities. Some believe genetic testing is only useful when someone is already ill. In fact, genetic testing also helps healthy individuals identify carrier status, estimate future reproductive risks, guide preventive healthcare, and support informed family planning decisions. Many people think cousin marriage automatically causes genetic diseases. The truth is more nuanced. Most children born to related parents are healthy. However, marriage between close relatives increases the likelihood that both parents carry the same rare recessive genetic variant, which raises the risk of certain inherited disorders. The increased risk is statistical rather than inevitable. Finally, some people fear that genetic diseases are contagious. Genetic conditions cannot spread through touching, sharing food, hugging, coughing, or everyday social interaction. They are caused by changes in genetic material and are not infectious diseases. Knowledge replaces fear with understanding. Compassion replaces stigma with support. Advances in genetics, genetic counseling, carrier screening, prenatal diagnosis, and modern medicine continue to improve the lives of millions of families around the world. The more we understand genetic diseases, the better equipped we become to make informed decisions, support affected families, and build a future where science replaces myths with truth.